Welcome to this lecture about case reports. So, the objectives of this lecture is to learn about case report, what's a case report, what can be a good case to write, how to structure a case report. Once you have a case report done, where you can publish, and when you send for publication, what do the reviewers use for acceptance? Case reports are one of the easiest ways to get published, and there is always a lot of opportunities to find good cases to write a case report. The cases you select for case reports need not be quite complex or completely out of the ordinary. Even a simple case which has got a good learning point can be a great case report. The value is based upon the knowledge you gain from the case. So when you do your rotation or when you manage patients, keep an eye for good cases. There'll be always plenty of opportunities to find some. So, what is a case report? A case report is a detailed report of the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient that happened over a period of time. It provides a quick communication between physicians. That we all know, with limited time on hands, physicians try to learn about managing patients, to read through journals, and case reports are an excellent source for them to learn about new illness, new findings, and improve their medical knowledge. So it's a very valuable publication. Even though case reports are not very common in many of the leading journals, and they have given less importance in comparison to scientific research, it's no way insignificant because it can give a lot of information for many physicians who come across that report. So, what is a good case report all about? So, there are various entities that can be written as a case report. So, it could be a unexpected association between a disease or symptom. For example, during the recent COVID pandemic, came to know about anosmia, it was unheard of. And after some time, we came to know that they are also at high risk of thromboembolic illness. So that's something which was unexpected, but somebody took the time and effort to identify that and get it published. Or it could be an unexpected event in the course when you are observing or treating a patient. For example, a patient was being treated with an antibiotic for an infection as simple as cellulitis. However, things didn't go well. And then after a few days, the patient began septic and he was into the ICU. And then maybe at that time, you found out the patient had an abscess somewhere else in addition to the cellulitis. So something which you don't expect in a bread and butter case. Or it could have findings that could shed new light on the possible pathogenesis of a disease or even an adverse effect from a drug which was unknown, or it could be a unique or a rare feature of a disease, like for example, Kaposi sarcoma is more common in HIV. So if you see Kaposi sarcoma in a non-HIV patient, that's unique. And also sometimes you can have therapeutic dilemmas and we may have to try a new therapeutic approach which might have helped. Or the human body has its own variations, and sometimes you can have anatomical structures which are varied, and that could be an interesting case to write about. Or you can have unusual combinations of conditions that leads to confusion. That's quite common in hospital practice. So that could be something interesting. Or if you have a new theory which you propose about the pathogenesis of the disease, that could be a material for a good case report too. So how do you structure a case report? Most journals require you to have a format when you write a case report. This is a standard version which you can use for almost any journal. Usually you start with the title, then comes the abstract, then comes introduction, then the case as such, followed by discussion, the most important part of the case report. It is followed by the conclusion, then the author's contribution is usually expected, and finally the references. So make sure you follow the order or whatever order the journal wants you. Title. That's the first thing that brings someone's attention to a write-up. So make sure it's attractive to the reader and also it states the focus on the issue. The titles are always concise. At the same time, it should be informative, relevant to the subject, and elicit a curiosity to the person who is coming across the case report. So let me give you some examples of titles. Looking beyond the heart, a very unusual case of heart failure in a healthy woman. This is the case which we published where we found out the patient had a uterine AV malformation which was the cause of her heart failure. So the title itself is interesting, and then it tells about an unusual cause. Then the second one is when absent seizures or not seizures, a case of insulinoma. So this was a patient who was thought to have absent seizures, and after admission, we found out that it was hypoglycemic seizure from insulinoma. Then a right atrial mass, where is it coming from? The statement itself elicits a lot of curiosity to the reader. Finally, an uncommon cause of abdominal pain following blunt abdominal trauma. So make sure the titles are interesting. Abstract, followed by the title, come to abstract. So why do we need an abstract? It's for the easier retrieval from electronic database. These days, everything is online. So to curate the information, abstracts are very important. And also it helps to determine the level of interest in the case. The physician can skim the abstract and then decide if he wants to read through the whole case report, because if it's not relevant, they don't want to spend the time on that. And also the abstract should summarize the case. You should tell about the problem it's addressing and also the message it's conveying. Abstracts are usually short. We recommend between 100 to 150 words, not more than that. Then comes introduction. So the introduction is a brief overview of the problems that the case has addressed. The introduction should also cite relevant literature. However, it's not to be exhaustive. it should be precise and succinct. The introduction generally ends with a single sentence describing the patient and the condition that he or she is suffering from. Then comes the case, the core stuff. So it's usually presented in a chronological order with enough detail so the reader can establish his or own conclusion about the case's validity. So it should be clear in the way that the reader can follow along and have his own conclusion as he or she is reading the case. How do we write that? So I suggest that we use an order so that's clear and unambiguous. Usually starts off with the patient's description. For example, we had a 65-year-old man who is an ex-smoker, non-alcoholic, with history of drug abuse, comes in with diffuse rash in his chest and extremities. Then the case history, expand on what happened from the time frame and also what are the physical examination results, any interesting signs, and the results of the pathological tests and other investigations. And then finally, write about the treatments, follow-ups, and also the diagnosis. So once that's been done, the next part is the discussion. So make sure you spend as much time as you can in this part because this is the deal breaker. This will convince the journal whether the case is publication worthy. That's what the reviewers will be spending more time on to decide to accept or reject the case. So what's the purpose of the discussion? It summarizes and interprets the key findings of the case. Also contrasts the case report with the pre-existing information from the literature, and also it should be justifying its uniqueness, making it worthy enough to be published. You should also mention the lessons or experiences that can be learned from that case and how this can be managed differently or in the same way in a similar situation or a case. So that's kind of the take-home message for the reader. How do we write the discussion? So start by expanding the information that was provided in the introduction, focusing why the case and the problem that it addresses is unique, and summarize the previously published literature and contrast how this case or the information which we gathered differs from the pre-existing literature. Then review and narrow down where it caused confusion or how was it challenging, how was it unique. Then try to mention the value the case will bring to the literature. That's the key here. And then don't forget to mention if there is any limitation to the case, and if so, what's the significance of the limitations. It could be lost in follow-up or an unexpected death when we are planning to do something, so on. So make sure you tell the limitations too. Finally, comes to the conclusion. It should briefly give the readers the key points that you have mentioned in the case report. And also the authors can give suggestions and recommendations for the clinicians. So that's how we end the writing part. Uh, you will be also asked to mention about the author's contribution. So the author who makes the substantial contribution should be listed, the first author. And if there is more than one, then the last author is generally the most senior person who was involved in the project. And if there is more than one author, you will need to have a corresponding author. It's often, but not always, the first author. The references. The references is very useful for the reader if they are interested in learning more about the information, so they can go back to the mentioned literature and read about that. And if there are some very important points, that should be validated by putting the references at the end. And it's not expected to have a very exhaustive reference list, so try to limit to less than 15 or so. Case reports are more interesting when they have figures, tables, or pictures. Again, this is not a big publication, it's a short form. So try to limit the table to one, and if there are figures, preferably less than three. Make sure you anonymize the photographs. Of course, we are sharing someone's private medical information, so we have to get the consent. It's an ethical requirement. So before you try to even write the case, make sure you get the written consent from the patient. You don't want to spend all the time and then unable to publish if the patient withholds consent. So make sure you do that firsthand. If the patient is a minor, please get it from the parents. Or if the adult is unable to provide consent, get the consent from the closest family member. Anonymity. The patient is giving the consent to publish their private information. So we need to respect their uh, rights and take all efforts so that their identity is not revealed or nobody will be able to identify the patient based on the information in the case. Make sure if there is any picture, they do not reveal the identity. Look for tattoos or medical alert bracelets which can reveal the identity. Make sure you keep an eye on that. And if you're using pathology slides, make sure there is no date of birth or sex. And also, if it's any radiology, EKG or echo, it's all the same. Please make sure they're 100% anonymous. So before you send, make sure you have an idea what the reviewers may look for, because that's what reviewers look into when they want to either accept or reject the case. The first point that they will be looking for is the case written well? It may look simple, so make sure there is no grammatical error, there is a good flow, and information is crisp and clear. The next point will be how important is this during the current scenario, and how relevant the literatures have been reviewed. Did the author spend enough time reviewing the literatures that are relevant to this case? And also they wanted to make sure these were not some incidental findings. These findings which has occurred has some value to that. And also, they want to make sure there was no compromise in the patient's care intentionally. And most importantly, they want to make sure there were no ethical violations in the case. So make sure you have this in mind when you write that. So this is what the reviewers look. Then they make the decision whether the case is acceptable or not. Where can you publish? There are a lot of journals out there. These are the common ones which we have been using with my residents. BMJ case reports, annals of internal medicine, clinical cases, which is something new which they have started to make it easy for students and residents to get published. And of course, we have our own South Dakota medicine and so forth. What next? So there are three outcomes. Either you are accepted without any changes being asked. It's very unusual, but it can still happen. Then you have, if it happens, you've done a really good job and lucky too. Most commonly, they will ask for a revised version. It could be either a major revision or a minor revision. So they will send it back to you with their concerns or questions, and they expect you to give an appropriate response, and then they can revisit the suitability for publication. Or at times it can be even rejected. But don't lose hope. There will be a feedback, and you can always use that and resubmit. And even if it's rejected again, it's okay. One day you will get published. And if it happens often, then remember Harry Potter. So for people who do not know, J.K. Rowling, when she finished her manuscripts, she gave this to 12 publishers, and all of them rejected back to back. And even one had the audacity to tell her, "You will never make any money out of children's book job." And you all guys know, the rest is history. She's a billionaire now. So you get published. That's the last thing you want with all your hard work. And once you're done that, pat yourself on your back, and I wish you the best of luck. Thanks for your time.